Back in October of 2019, I had a sudden cardiac arrest at work. Paramedics got there and took me over to the hospital. They did pronounce me dead at the time. Because of all that, I've never had heart problems before or anything like that. They did have to put in a defibrillator. And then back in 2021, I started to not feel real good. My blood pressure kept dropping, so I went back to the hospital. They found out I had an infection. They put in a PICC line to have antibiotics for 6 weeks. Then approximately 3 days after the PICC line was taken out, I was at work again and wasn't quite feeling right. After about a week in the hospital, they finally found that I had an infection on the defibrillator that was put in. By the time they took it out, the infection had spread through my whole body. They did have to put in an ileostomy bag, so I lost half my colon. Was in a coma for, I'm not sure, a couple weeks, I believe. At some point during the coma, when I was laid up in the hospital, either they didn't get enough circulation to the right leg, whether it was positioned incorrectly, it somehow messed up the nerve here on the bottom half of your right leg. They're not 100% sure at what point it happened during that time. They just know that it was pinched off long enough that it lost the feeling to control my foot. So if you go to walk, you know how you just walk like a normal person, the foot would curl, it would roll. So it would either roll this way or it would roll to the side. So I could never get my foot to lay flat. And then the pain on the top of the foot was like no pain I've ever experienced. And I've had 2 kids, so no pain. So at home, I did at-home rehab for 2 months. Then I think that's the point I came to see Dr. DiPierro. He said that he thought there was, depending on what the nerve study showed, that there was a possibility of a surgery he could do to improve the nerve function, to get my foot function back and to lose the pain.
During my surgical training, actually was toward the end of it, I started to get exposed more toward what could be done for people with diabetic peripheral neuropathy and nerve problems or nerve-related injuries, and it really interested me. I just wanted to learn more, and as the years go by, things continue to improve, so I want to continue to stay up to date on what I can do for my patients for their problems. Ultimately, one of the problems was that Denise had a nerve that wasn't working. We were able to get that nerve working again by doing what's called a motor nerve transfer, by taking a working nerve and transferring it to the non-working nerve to get her muscles working again.
But it just was a small scar. The surgery, I don't think lasted longer than an hour from what I remember. And once the anesthesia and everything wore off, it was an outpatient. We went in the morning and I was out that afternoon. To be 100% free of the pain, to me, that knocks it all apart for me. And now I'm able to walk without a brace and without a cane and without anything.
The thing that pleases me the most about Denise is seeing that she's out of pain and that she's functioning at a higher level and that she is more vibrant and happy compared to the first day that I saw her. And that means a lot to me.